Okay, we're ready. Thank you all for joining. I appreciate that. It's 1 week from the inauguration, and the subject of this meeting is homeless policy in the Biden administration. Even before Joe Biden and Kamala Harris were elected, they put out an 18-page summary of their commitments on homelessness and poverty. That's still on their campaign website. We'll share that link in the chat box, and we will discuss some of what is in those promises on homelessness and housing. And since the election, Joe Biden has also made a number of commitments on vaccines and on homeless assistance and housing rental assistance as part of his American Rescue Plan. We will talk about some of those points in this meeting as well. No matter whether you are new to homelessness and housing advocacy or you've been working on these issues for years, I want to underscore the unique moment that we're in. Going back to the beginning of the era of mass homelessness in America, in the 1980s, we had a White House that was conservative under Ronald Reagan and a Democratic Congress that was very focused on deficit reduction. I lived through the Graham, Rudman, Holland debates on the debt. I worked with Mitch Snyder at the 2nd and D Street shelter back then, and I remember the Reagan years all too well. And the housing budget was being cut, not added to back then. As Clinton came into office, I remember also the excitement of getting his economic program passed through Congress, and then vividly the meeting I had with a deputy assistant secretary at HUD a few days afterwards, who explained to me that the budget caps in that legislation meant that there was no new money really for domestic programs of significant scale, which means there wasn't funding to put back the money that had been cut out of the housing budget during the 80s. And so through Democratic administrations and Republican administrations for decades, Washington has failed to deal with the homelessness crisis. We are in a unique moment now, an unprecedented moment where those politics have shifted. We have, under the Biden administration, a commitment to pass Maxine Waters' homelessness bill to fully fund Section 8 for everyone who needs it and wants it, and many other things. And so the stakes are high, and we're going to run through some of the commitments in homeless policy in the Biden administration on this call, and then think through with you a field strategy to lock down the resources and the policies we need to bring people inside. We'll start with Chandra Crawford, who is the Alliance's Director of Individual Homeless Adults. Dr. Crawford is going to talk about some of the vaccine issues that are part of the administration's promises in the rescue plan. She has deep expertise in healthcare policy, and we'll start there.
Thank you, Jerry. Okay, so there are the slides. And thank you, Jackie, for flipping them. So hello, everyone, and welcome again. So let's get to it. Jackie, if you could flip the next slide. Let's talk about the vaccines for COVID-19. And here's the outline. So I'll start by giving a really quick overview about COVID-19 from the CDC. And basically this coverage would be the basics. So I really want to set the groundwork for our discussion today, right? And then I'll discuss the advisory committee on immunization practices, and that is ACIP, the abbreviation. And they're connected to the CDC to discuss their recommendations on the vaccine rollout. And lastly, which is what we really want to get to, is we'll talk about the rollout in relation to people experiencing homelessness and people working in the field. And we'll also touch upon President Biden's national strategy and what was released the other day. Next slide, please. So let's move to the basics, right, to set the foundation. The next slide, please. And these slides are from the CDC. I'm sure many of you probably caught their webinar maybe last week or so. And so in case you missed it, these are some slides from their discussion. So of course, just some basics. We know that COVID-19 can run the gamut in terms of illness, and that can range from mild to severe and unfortunately to death. And so this is what I want to draw your attention to on this slide, is probably the last point about people who are 65 and older who are at greater risk, and then those with certain medical conditions being at greater risk of being severely ill. And so this is related to the discussion that we'll have a little later about those who are sheltered versus those who are unsheltered. So hold on to that. We're coming back to it. So next slide. As a good steward of health, this slide is just a reminder of how to prevent COVID-19. I couldn't take this slide out, so we had to keep it in there. Okay, next slide, Jackie. Thank you. So we know now, right, that we have 2 vaccines that are available. One is from Pfizer and the other is from Moderna, and they've both met the FDA's safety standards. Next slide, Jackie. Thank you. So once approved, ACIP or the CDC, given the limited amount of doses, made recommendations about who should be prioritized first, right? So you're looking at the first phase. And this is really where many states are now, and the phases can overlap. So it's really complicated, but this is a simplistic example. So we see for 1A, priority is recommended for healthcare personnel and residents of long-term care. 1B, 75 and older, non-healthcare frontline essential workers. And then you see 1C is for folks 65 through 74 years of age and 16 through 64 with high risk medical conditions. And then other essential workers not noted in 1B. Jackie, next slide. So where do people experiencing homelessness and those in the field fit into this chart? That's what we want to talk about today, right? So we know people experiencing homelessness, and I don't need to tell this group, that they are at great risk of COVID infection because of factors, of course, related to being experiencing homelessness, being unsheltered, the medical conditions that go along with that, due to congregate settings, etc. And so, as shown by the CDC, and again, these are some of the information presented from the CDC's webinar recently. People experiencing homelessness in New York, and these are sheltered populations, they had higher mortality rates than the general population. And they also presented, I didn't use the chart, but they also presented a similar example. I think it's in Chicago. Next slide, Jackie, please. And so Minnesota reported, these are just examples, higher hospitalization rates among people experiencing homelessness, sheltered and unsheltered. And in fact, as you can see, the unsheltered rates were higher. So you can go to the next slide, Jackie. So to go back to the question of the vaccine rollout. So one of the things that the CDC is saying is that staff and residents of homeless shelters, they can receive vaccines at the same time because of shared risk, in case states were considering prioritizing these groups at different levels. But the key thing to really take away from this conversation is that at the end of the day, states, they have the ultimate decision, if you will, to define how they're prioritizing the vaccine rollout. And many of them have updated their plans, and they can really, oh, someone said the audio stopped. Is that just one person, or is everyone able to hear me still?
I'm still able to hear you.
Okay, great. Oh, okay, people can hear. Okay, okay, got you. So, well, this is being recorded. So, to the person who's missing out on some of it, we apologize, but you'll be able to catch us again. So look, these plans, some of them, they followed the recommendations to a T, and then some of them they've put correctional officers in 1A. Some communities, such as Utah, they've prioritized racial equity, and they focus on tribal nations and indigenous groups. And then, of course, some of the plans have been updated to include homelessness in phase 1. And so, Jackie, you can flip to the next slide. Thank you. Now, a lot of the emphasis has been, from what I've seen, has been on congregate settings. And so about 26 states have included settings like shelters, and that's been in 1B. And then obviously that includes, staff and residents. And so places like Nevada, for example, they just mentioned homelessness, for example, in 1C, and not just in the context of congregate settings. And so, you really got to follow your state plan and see how they prioritize groups, because obviously the people that we typically serve could fall under 1C, given medical conditions. And even some states have even expanded and placed medical conditions higher than 1C. And they've expanded that definition so that even more people could fit under that category. But it all depends, again, on how states prioritize these phases. And that includes people who are unsheltered and outreach staff, because remember, a lot of it talks about congregate settings. So from an advocacy perspective, and like I said, some plans, some portions haven't been updated. And so states are still, in that process of figuring this out, right? And so as they continue to think through these decisions, it's important that, public health officials hear from you, hear from us about how people experiencing homelessness are at severe risk, to make sure that they and staff are prioritized. And that also includes people that aren't necessarily in congregate sections or work in that sector. And so as I mentioned yesterday, the Biden administration, they've released a strategy to address the COVID-19 pandemic. And obviously they talk about vaccine strategy. Oh, and I should say on this slide right here, you see the link? Look on the link and check out where your state is. That's why I put that link in there, because it gives the state-to-state update of who's submitted what. So Jackie, can you go to the next slide, please? Thank you. And so those are just some of the 7 overarching goals of the plan, right? So that's just so that you have kind of a big overview. Okay, Jackie, next slide. And of course, there are a ton of things to take away from this report, but I just threw some things together that are really important to us. And here's the key thing. So there's a big commitment in the document for equitable access for hard to reach populations. And then there's another push for the creation of more venues for vaccines in community settings. There's a drive for equity. And then what I definitely love is that there's a lot of talk about social determinants of health. And there's talk in there about working with Congress to create and to build upon social safety nets, and housing is a part of that discussion. So hopefully the administration will be able to work with states to fulfill these goals. And because obviously we appreciate that push. So we want that report to trickle down to the states, and we want hard to reach groups centered, as this report is doing. We'd like to see the push for equity, and obviously the other push for social determinants of health, things like housing. And we know getting how important having someone housed and then receiving proper care, the connection between the two, how important that is. And so there's some really good stuff coming out of this report. So that's really it for me. I just kind of wanted to give an update to people in terms of where the states are, some of the key things from the report. And so, and those were some good resources that the CDC offered at their webinar that I thought would be useful. And let me see if I have any questions here that I can go through. So is it possible? So people, I believe, let me just ask about the slide deck for today's presentation. I'm not sure. Jackie, can you answer that question about, I don't.
Can.
Okay.
Yeah, so, excuse me, after the webinar is over, we will be sending the recording and the slides out to all of the participants who registered, and they'll be located on our website as well. So anyone who wants access to it will have it.
Okay. And so I'm trying to see if there any, let's see, so specifically on veterans homelessness. So there's a question, are we planning to focus or emphasis specifically on veteran homelessness, especially due to increased risk of suicide? So I'd have to go back and look. So my contact is listed on the page. And so send me an email because that is an important question. And I actually don't have that data in front of me in terms of the vaccine. So let me get back to you on that one, okay? And let me see, I think I have a few more minutes. So I'm just going through the questions. So we have been told, and I'm just reading them, so I haven't reviewed them, but other people may share some of the same questions. And so I'll just read them out loud and let's see. We have been told that national shipments of vaccines have halted for the administration change. So when will shipments of vaccines to states resume? And when will the logistical plan for distribution be implemented? And so I'm not sure about the shipments. I know, and actually today, if we, Jackie, can you go back to the slide where I have the 7 strategies? Because I can't think of yeah. And so part of that was the Expand the Defense Production Act. And I know that Biden made President Biden or his administration made an announcement about that today, but I didn't get a chance to tune in to that. So we'll see, but that's a part of that. I don't know if I haven't heard anything. I don't want to give you misinformation. So I don't know if the national shipments of vaccines were actually halted or not. But I know that the Biden administration, as part of their plan, is that they've made a commitment to stepping up the shipments. And I think that there was an announcement that states would be receiving more of the vaccines. And so, like I said, there was some discussion on that today, but I haven't been able to catch that. But again, if you email me, and my email address is ccrawford@naeh.org. I will most certainly follow up with you. Okay, so I think I might be out of time, but again, no worries. You all have my email address, and I most certainly do not mind personally responding and getting information back to you. So thank you for participating, and I'm going to turn the mic back over to Jerry, who I think is going to introduce our Vice President of Policy, Steve Berg. Thank you.
Thank you so much, Dr. Crawford. So yes, next we'll turn it over to Steve Berg, the Alliance's Vice President for Programs and Policy, who's going to describe what's at stake in the Biden legislative agenda.
All right. Good afternoon, good morning for those on the West Coast. Steve Berg, the Vice President for Programs and Policy at the National Alliance to End Homelessness. Thank you all for attending. We have well over 1,700 people on this Zoom webinar, and we're happy to see this kind of interest in this. I'm going to talk for a few minutes about what we're looking ahead to in Congress related to homelessness. And then you see I've labeled this a preliminary look, and it's very preliminary. Congress is still at the stage of getting organized. They still don't know who is on all the different committees and who's in what kind of positions. So, but at the same time, there are some things they're already trying to move. So I'm gonna focus a lot on issues that are up for grabs really over the next few weeks, and then talk a little bit about what the rest of the year will look like here. And then we'll take questions for anybody who wants to ask them. So next slide, please. So there's three sort of categories of issues that I said. Right now, there's a COVID-related crisis response that people are literally hashing out today, right, as we speak. The staffers on Capitol Hill are working to figure out what needs to be in an initial COVID crisis response bill. The second issue for us is issues about strengthening the homeless assistance system. A lot of that is really about funding for HUD's homeless programs and for other homeless programs that are funded by other agencies. And so that's usually a big part of our advocacy agenda for the year. It hasn't really, that process hasn't really gotten started much in Congress yet, but we'll touch on it. And then the third big issue is the issues around housing more generally. Housing for low-income people, affordable housing. I think there are opportunities this year that are really quite profound, and we want to talk about those too, even though they might not be coming up in Congress like right now. They'll be getting to them fairly shortly, and we want to be ready to go. And then, as I said, other possibilities. Other members of Congress are figuring out what bills they're going to introduce, but not many of them have been introduced yet. So as the year goes on, there will be other opportunities to get important work done. And we don't know what that is now, but as Jerry said, this is a preliminary look at these issues, and we'll talk to people about them over the course of the year. So next slide, please. So some things that are going on in Congress right now. As I said, they're working right now on this emergency response bill, what President Biden has characterized as the rescue phase of his response to the current crisis. That will probably be done. We'll talk about it more in detail, but they're working on it right now, and hopefully hoping to be done with something by mid-March. Then there will probably be another big emergency bill that will be more about recovery from the economic downturn, less about healthcare and more about the economic downturn, and that will also provide some opportunities. There will be the regular appropriations process. Appropriations, as many people on here know, is the process of setting funding levels for the various discretionary programs that Congress does every year. The HUD programs and homeless programs and other agencies all get their annual budget approved, and that process will begin before too long. And then other legislation, and as I said, Congress is just getting organized. Members are trying to figure out what bills they introduce, but there's very important legislation that's going to be part of the outside of the regular spending process. So we'll talk about that too. Next slide. So one thing people need to know about, a very technical thing, is reconciliation. Reconciliation is a kind of bill and process that is important to know about, and the reason it's important to know about is it only requires a bare majority in the U.S. Senate to pass a reconciliation bill. As people know, the split in the Senate is exactly 50-50 between Democrats and Republicans. Usually, to pass substantive legislation, it takes 60 votes in the Senate to overcome a filibuster. But reconciliation allows that to be done with just 50 votes. Reconciliation includes a couple of different kinds of processes. It requires a budget resolution that sort of sets the overall spending levels for the year, and then includes what's called reconciliation instructions, where the budget committee tells each of the other committees in Congress how much money they should be either increasing or decreasing the programs under their jurisdiction to meet the overall budget targets. It's only to deal with financial issues. So one of the problems with reconciliation is that it under most circumstances, you can only deal with money issues. So, or with issues of federal spending and taxation. So issues like an eviction moratorium, that may be that can't be dealt with through reconciliation. It's still a little it's still uncertain because it definitely has effects on federal spending. So those will be issues that have to be worked out. It requires additional work. There's the Senate Budget Committee has to get involved, as well as the committee with jurisdiction over housing. The leadership gets involved. It's more work to do a reconciliation bill than a regular bill. It can only be used once every fiscal year. It has not yet been used for fiscal 21, which is the fiscal year we're partway through with now. So a reconciliation bill could be passed for fiscal 21, and then another one passed this year to deal with fiscal 22 that starts in October. So that's reconciliation. You'll be hearing a lot more about it this year. So for the rescue bill, that's the thing that they're working on in Congress right now. These are our asks, the things that we, together with other organizations like the Center on Budget and Policy Priorities and the National Low Income Housing Coalition, have gotten together and determined that these are what we're seeking in this rescue bill for homelessness and low income housing. Money for homelessness, specifically, 6 to 8 billion. We're not quite settled on that. I think the people know that recently FEMA announced that FEMA would pay 100% of the money for non-congregate shelters for certain homeless people, and that may mean we need less money for this. But right now the ask is in the $68 billion range, specifically money for homelessness. Additional money for emergency rental assistance. You know, in the bill that passed in December, the emergency bill that passed in December, there was $25 billion for emergency rental assistance. That's in the process of being distributed. We're asking for another $25 billion in this. A third thing is we're asking for vouchers. The emergency rental assistance is sort of short or medium term, but we know that some people who are experiencing homelessness and have been left out on the streets by the coronavirus and the economic downturn need longer term rental assistance. And the federal voucher program, the Housing Choice Voucher, AKA the Section 8 program, is where that comes from. And then finally, acquisition funds. We have seen a number of places in the country have realized that they've got a lot of empty hotels or other kinds of residential buildings, and that if they had money, they could buy those, convert them into either shelter or long-term housing for people who are homeless, and increase the stock of housing that's available to people. And it would be important for Congress to put some money on the table to help communities do some of that acquisition. So those are the things we're trying to get in this rescue bill. Next slide, please. A couple of things about the process. As I said, working on it right now this week. Anybody on this call, as soon as this call is over, if you want to call up your members of Congress and tell them, please call up the chairs of the appropriate committees, the committees that have jurisdiction over housing, and tell them these are the things we need. And the 4 things I just mentioned. Today would be a good day to do it. Tomorrow would be a good day to do it. Those committees are putting together their lists this week. And we're thinking probably after that, it'll be more the congressional leadership that makes the decisions. So then the other targets besides those committee chairs will be the congressional leadership, Nancy Pelosi in the House, Senator Chuck Schumer in the Senate, and then their Republican counterparts, Senator McConnell and Congressman McCarthy in the House. Will this be a bipartisan bill, this rescue bill? You see a definite answer from me, a definite maybe. I think the leadership, the Democratic leadership in House and Senate are trying to get Republican support for this. They probably will need to use the reconciliation process in the Senate. I think right now the feeling is it's unlikely that they get 10 Republican senators to sign on to something that's as aggressive as they want it to be. But that doesn't mean there won't be any Republicans who will back it. So I think people who have Democratic members of Congress, you should be talking to them. But if you have Republican members of Congress, you should be talking to them too. And as you said before, they're trying to get this rescue package done because there are certain aspects of the emergency unemployment program that run out in the middle of March. And so they would like to get this rescue package done by then. That's the timeline. So that's the rescue package. A couple more quick things. Next slide, please. I think homeless appropriations, people who've worked with us in the past know we treat the appropriations process very seriously. Our goal this year, at least what we're now putting out as our goal for appropriations, is a $300 million increase for homeless assistance. Last year, the increase was $225 million. That was the biggest increase we've really ever gotten. So we're very happy with the great work that a lot of people on this call did to convince their members of Congress to put that on the table. Meanwhile, the situation's gotten worse, and so we need the money to actually deal with it. We'll have other appropriations priorities that will be developed, working with partner organizations, working with the new administration. People are familiar with the 302B letter. That's sort of the first thing we do on appropriations. 302B is a section of the Federal Budget Act, but basically the letter will ask that the appropriations subcommittee that has jurisdiction over the HUD programs get as much money as possible. And lots of groups will sign on to that letter. The last few years, it's been sort of if you signed on before, we'll just treat you. I think this year, because it's a new Congress, new administration, we're sort of starting from scratch, building that list. And all the different national organizations that deal with housing issues will be behind this effort. So you'll probably be hearing about a 302B letter coming probably sometime within the next few weeks, with a deadline a little later on. So I saw there were some questions about that, and that's what's going on with that. The key period will probably be for appropriations is usually in the summer. Once the subcommittee gets told how much money overall they have to deal with, then we have to make a lot of noise to make sure they prioritize these homeless programs and the other priorities that we need this year. So that's homelessness appropriations. Again, the process hasn't really started yet, but it's going to be starting shortly, and we'll have a lot more detail about that later on in the year. Next slide, please. And then finally, big changes to housing policy. I want to just make sure people understand how historic this proposal is that was in Biden's campaign platform to make the Housing Choice Voucher Program, otherwise known as the Section 8 program, a mandatory program that's funded so that everybody who's eligible gets the help. Personally, I can say I first learned about the Section 8 program when I was in law school and doing a clinical program, and we had a class about different federal anti-poverty programs, and learned about the federal program, that the Section 8 program was something that people wait on waiting lists for years and years and years in order to get. And I remember the first case I handled as a clinical lawyer was a woman who was well, she was not getting evicted. Her landlord wanted to evict her, but that wasn't happening. But then right in the middle of it, she finally got a Section 8 voucher, and she instantly moved out of that slummy apartment she was in and into a nice apartment. And just the way it improved her life and her family's life was just very striking to me. Well, at that time when I was learning about the program, the thought was these programs serve about a quarter of the people who are eligible. This was it was several decades ago, and still it's the case that only a quarter of the eligible people get help. And it means people losing their housing all the time. That means we have to have these big homeless systems. It means bad effects on health, bad effects on employment, bad effects on civil rights. If this were to take place, this one change would be monumental. And we now have a president who has made that commitment in his campaign platform. Everything we're hearing from the new Biden administration is that they took that promise seriously and they intend to try to get it. And so I think we at the National Alliance to End Homelessness are going to treat this as a very big priority, and see where we can take it. That we're hoping. Biden is expected to give a speech to a joint session of Congress that will probably be late February. At that point is when we think he will outline his recovery proposal. The rescue proposal is the first proposal, and the recovery proposal is the next big emergency proposal. We're hoping that the universal vouchers will be in the recovery proposal. Will Congress undertake it? Good question. We're hoping that the next big recovery bill that Congress undertakes that I talked about before will include this. It may be done through reconciliation. It's not a small amount of money. I mean, some of the estimates we're hearing would increase federal spending by about $90 billion a year. On the other hand, that's compared to what we spend on some other things, that's not really that much money, and it's the impact it has on people, it's money well spent. In terms of big changes to housing policy, besides the universal vouchers, you may be familiar with the Opportunity Starts at Home campaign, OSA. They have a website you can look up. This is a number of different groups, not just housing groups, but other organizations that deal with issues that are impacted by housing, to really work at getting affordable housing more available to low-income people around the country through rent subsidies, through capital expenditures, to other pots of emergency assistance. That agenda, the universal vouchers, is part of that agenda. The National Alliance to End Homelessness is a founding member of OSA, and that agenda, I think, is going to be ongoing, not just for this year, but until it gets done. I mean, I think OSA was originally conceived as a 5 to 10 year campaign. I think that, as Jerry was pointing out, the opportunities we have now make me think that some of the things on here won't take that long. Maybe we can get some of it done faster. Okay, next slide, please. So that's me. Again, I would say thank you to everybody who's on this call. We we have a lot of work to do, but I think very good opportunities this year working with Congress to make some real changes in what kind of funding is available, what kind of programs are available. A lot of work to do on coordinating these housing programs with healthcare programs, with employment programs. So again, this is our first outreach on this year. We'll continue to be in contact with all of you and other people who are interested throughout the year. But thank you for your interest. And now let me just take a quick check at the Q&A and see what we can get here. So I want to get back to the question about the veterans issues. Again, we're pretty certain that there will be a lot of interest in the Biden administration, and there continues to be interest in Congress on how to deal more effectively with veterans homelessness. Again, it's still new to the administration. A lot of those conversations haven't really been had yet, but I think that making the HUD-VASH program work better. People already know the last Congress passed the bill that we worked on to make more veterans eligible for HUD-VASH. We're trying to do more to deal with the fact that sometimes the VA doesn't have enough staff to do the casework on it. So there will be more on that. We're not sure of what it is yet, but we're happy to hear ideas about what it is. Let's see, there are a number, there's a question about whether the Biden administration will undo some of the Trump administration's policies. There's every day, you know, people follow me on Twitter know that I tweeted something the other day about how, like, looking at the press release page on the White House website has become a daily pleasant activity. So there's new stuff coming out every day. There's a lot of things on immigration that have come out already, and more to come. So we don't know exactly what will happen with some of the immigration issues that have caused so much pain for people who are homeless and so much difficulty for people working on the issue. But we'll continue to follow that and let people know what comes up. There's questions about USICH. We don't know anything about USICH, what the staffing there will be like, but we'll let you know as soon as we find out. So a question just so I can talk about this again, a question came up about what will it take to get the Section 8 vouchers to be a universal program. And I think it will take a lot of people, I think, talking to their members of Congress about how that works. There is one of the things the OSA campaign did is they did some public opinion research on housing and found that actually the public support for more housing for the lowest income people is actually very strong. If you read the newspaper about NIMBY responses, you would think, oh, the public is against this. But the people who are out there complaining about new affordable housing units are a small minority in most communities. We know that these things are backed by a majority of the public. And we need to keep getting that message to people in Congress who can do something about it. And that's really every member of Congress. I think this idea of Section 8 as an entitlement or a mandatory program or a universal program, I believe it's definitely doable with the president on board with it. I think the leaders in the different committees who have jurisdiction over this are on board with it. So, like I said, that's going to be a big priority, and we need everybody's help with it. Let's see, I'm just going to look at a couple of more of these. So there's questions about the new FEMA policy, and a lot of that is, I mean, the policy just got announced and there's a lot of questions like, can you go back and ask for it if you haven't asked for it before? I think that's definitely going to be the case. Is it retroactive? We don't know that yet. Does it apply to any homeless person, or does it only apply to homeless people with particular medical conditions? That, I think, is an issue we're working with them on. We would like it to apply as widespread as possible. So yes, I know we're answering a lot of these questions like in a way that says, well, we don't know yet, but we'll let you know, and that's just the condition in which we find ourselves. But I think the response to this call is very encouraging for us, and we'll be sure to let people know as soon as we learn things about this. And so let me, at this point, stop and let me turn it back to Jerry. Jerry's going to talk a little bit more about what our advocacy work is going to be like, what kind of things you can do to get involved, and then we'll deal with more questions. Jerry, you want to take that?
Yes, thanks, Steve. And we will circle back to as many more questions as we can answer before the top of the hour. But to underscore what I think the message has been for this webinar, the Biden administration has made bold, ambitious commitments on homelessness and housing. Now, we're not naive, and we understand these things only happen if we fight for them. One of the questions I saw in both the chat and the Q&A that was asked multiple times is, how much exactly are we talking about for the Section 8 for vouchers that would be fully funded? It's about $90 billion. That kind of money, the kind of money that's going to be needed to backfill the decades of housing cuts that have created the homeless crisis we're in, is not going to be cheap. And there are certain things that a national advocacy organization like the Alliance can do inside the Beltway. You know, we can tweak the wording of a regulation or adjust a line item here or there, but for that kind of money, it's going to take a national push to get Congress to go along with what the president himself has already committed to do. And so, you know, in the words of Frederick Douglass, power concedes nothing. Without a demand, it never has and it never will. People in Washington are fond of quoting historical figures. I was here in the Obama years when it became a running joke. Every interest group that got a meeting with President Obama and laid out their agenda would hear from the president the same anecdote. He would share the story of when A. Philip Randolph met with Franklin Roosevelt in the 1940s and to press the president on civil rights issues. And FDR told A. Philip Randolph, "I agree with everything you're asking for. Now go out there and make me do it." Which in essence is saying, I need you to build the public pressure to create the political cover to let me do the right thing. That's the world as it is. That's what it's going to require. And so having said all of that, what is needed now is for us to strengthen our rapid response network with all of you. We need your help. And for what we're fighting for, it's going to take a national grassroots network to secure these resources and these policies that have been promised. And so the most straightforward way you can play a part in this is to email the National Alliance. My email address is beside my name. When you review this with the recordings, you'll also have the addresses for Chandra and for Steve. What we need, all of you are on some list of ours already, or else you wouldn't have gotten invited to the webinar. But what we could really use at this moment, with the unprecedented opportunity we have, is for you to send me your name, your organizational affiliation, and which congressional district you're in. And if you're not sure about your congressional district or districts, if your organization is in multiple ones, send us your physical address and we can figure it out from there. From that information, we can communicate with you on what's happening, keeping you up to date in what will be a fast-moving policy debate. We promise we're not going to ask you to do things that won't make a difference, but there will be strategic moments where we will have to push if we want to, as I said before, lock down these promises that have been made on housing and homelessness. And we feel a special obligation, especially those who have been at this for years and have, pushed hard when the politics just weren't there. Now that we have an opening, now that there's finally a moment to make some progress here, a special obligation to the people we serve who are out on the streets with nowhere to go. We have to do everything we can, especially in the next period of legislative work to nail down these commitments. So having said all of that, let me return to a couple of questions, and I'll pass some of these to Steve. One was, what will it take to increase resources for Section 8 vouchers for all who apply? Again, about $90 billion. Question from, that was Catherine Welch. Meredith Montgomery asks, what does it mean for permanent supportive housing if we also secure the universal vouchers? There will clearly be a need for housing with services for folks who need a higher level of care and certain supports. So one does not replace the other, but having the rental subsidy in place makes it a lot easier to envision expanding the stock of PSH. Marian Sanders from LA asks, given the crisis we're in, is the timing right to push for a federal policy that's about housing as a human right? If you go to Joe Biden's campaign website and click on the platform that we've talked about on homelessness and housing, the link is in the chat. You'll see he talks about how housing should not be a privilege, it should be treated as a right. So we're in the unique opportunity of finally not having to convince the key policymaker to agree with us, but rather to hold that policymaker to the promises they've made. Let me now scroll through a few other questions, and Steve, I'm going to pitch some of these to you. Let's see. And you should survey some of these as well to see which ones we want to get to and have time for.
Yeah, so let me.
Locally, we're worried about here's one, the COC NOFA. We have projects that will run out of funds in March. Any idea when the money might be released?
Okay, so I can start with that one and say no. It'll be very brief. Congress passed a lot. Part of what they passed in December was giving HUD the ability to give out renewal funding for continuum of care without going through a full competitive process or without going through any competitive process. So we're hoping that will go quickly. And now that HUD has some leadership staff on board, we'll hope it will move fast. And I believe they very much understand people's distress about not getting funding, but you at least won't have to do a competitive program. A couple of things about the Section 8 expansion. One, it's billion, not million, $90 billion a year more than what we're spending now. The Section 8 program is about $23 billion now to serve a quarter of the people who are eligible, and in order to serve everybody and deal with rising rents over the years. That's just the sort of a preliminary estimate of how much that would cost. Money well spent in everybody's thoughts. Now, the other thing about this, I mean, there were questions about like subsidizing private landlords, and Section 8 does that. That is definitely true, but it's also true that if we turned Section 8 into a universal program, there is no way that the existing sort of private market can handle that many vouchers. There will need to be new housing built specifically to house low-income people and to be affordable to people who have vouchers. And, you know, the vouchers only pay a certain amount, and it's not a luxury rent. It's meant to be a basic rent. So communities, Congress, we believe, will include money for building more housing, for converting existing buildings into housing. I think a lot of communities, California has sort of done this the biggest, but other communities are doing it too, taking hotels that are no longer economically viable, turning them into permanent housing for people who are homeless. There is a push to get money in this rescue bill to include acquisition funds that communities can use for that. They can also use other kinds of money. The CDBG money is good for that. But the vouchers will be available to house people in those kinds of buildings too. And in affordable housing developments that are owned by nonprofits, that are owned by local housing authorities. So it's not exactly public housing, but it is publicly controlled housing, possibly tenant-owned co-ops, things like that, which takes it even a further step toward sort of decommodifying housing. So I think the Section 8 program, when made a fully implemented universal program, will start having a lot of different impacts than the way it does now. One other question was, does the rescue bill have a name yet? No, it doesn't have a name yet. No bill has been introduced yet. So I think people on the Hill are just, if you call your members of Congress and tell them the rescue bill has to have 68 billion for homeless programs, then they'll know what you're talking about. And if they don't, then you can explain it to them, and then then you'll have a new friend. Okay, other questions?
I think that might be, well, there's two other questions in the final minutes. One was about a sample letter or letter template for communicating with the Hill, the other sample scripts. So again, we're at time, but I encourage you to contact us with your name, your organizational affiliation, what part of the country you're in, as specific as you can. We need to identify people by congressional district. If you can play a role in this fight, we are confident that there are resources and new policies that are within reach, but we can't take for granted that the president's simply going to do this without pressure from the advocates on this webinar. So I want to thank everyone. We're at the top of the hour. This was a tremendous response for folks to listen to this update on homeless policy in the Biden administration. The webinar will be recorded and on our website soon, and we will be following up with everyone who reaches out to us to get to work. Thank you again.